So occasionally patients who present with neck and arm pain may also complain of symptoms in the legs. And under these circumstances, it's possible that the cervical disc is also causing some pressure on the spinal cord in the neck, and under those circumstances, a patient may have upper motor neurone signs in the legs. So the first thing we need to assess when examining the legs in this circumstance is the tone. So we'll just move the patient's leg around and assess the tone, and I do this both by doing these active movements and also by asking the patient to relax and lifting the leg and moving it around. In a patient with normal tone, you'll see that the foot remains on the couch, and in a patient with increased tone, just stiffen your leg up for me, you'll notice the whole leg is likely to rise as one. So having assessed the tone, you want to then look at the power in the legs. And a patient who's got a cervical spinal cord problem will have a particular pattern of weakness in the legs. And we call that the upper motor neuron pattern of weakness. And the muscle groups which are predominantly affected are flexion at the hip and dorsiflexion of the ankle. So, could you just lift your knee off the bed for me? So here we're assessing the power of hip flexion. And then if you push your knee down hard into the bed, and that's hip extension. If you could just lift your leg up for me, so supporting the weight of the thigh, and if you could straighten your leg out for me, so that's knee extension, testing the power of that, and now flexion, if you bend the knee, and the power there. And then if you just rest your leg down, and then we'll look at the power of dorsiflexion, bend your foot up towards you, hold it there, and keep it there. And then push down against me, plantar flexion. You then ask the patient to invert the foot, so to turn your foot inwards, hold it there, then eversion is moving it outwards. Fine, so having examined the myotomes, we're then going to have a look at the reflexes, and in a patient with a spinal cord involvement with a cervical disc, then you'd expect the reflexes to be exaggerated and brisk. So we'll just lift the knee off the ground, try and relax for me. Feel for the patellar tendon, which runs between the patella and the tibial tuberosity, and then do the reflex. And here we have, Tom has just got a reflex there in his knee. We'll just compare with the other side. Just relax. And again, reflex just present. And as I mentioned earlier, there's a great variation in normality with reflexes, but certainly Tom's reflexes are not brisk. We'll do the ankle reflex. So looking for the Achilles tendon and striking a firm blow. And you can see both the foot moving and the muscle contracting. And the final test that you want to do when you're looking for upper motor neuron signs in the legs is to do the plantar response or Babinski response. You can use the bottom end of the tendon hammer. You must warn your patient that it's uncomfortable, and you're looking for the movement of the big toe. So a firm scratch, and you'll notice that Tom's toe moved down. And now I'm going to ask Tom to show you what happens with an upper motor neuron response. So when you scratch the bottom of the foot, and then the toe goes up. And that would be an upgoing plantar response, which is suggestive of an upper motor neuron lesion, which in the context of a patient with neck and arm pain could represent pressure on the spinal cord.